3 years ago, Aurelio Palma went to see a doctor for a routine checkup. But during his exam, he was told that his heartbeat was irregular and that he needed to see a cardiologist. But at the time, Aurelio only had limited emergency Medi-Cal coverage.
When I tried to schedule an appointment with my specialist, they let me know that my emergency Medi-Cal wasn't going to cover the cost for that type of examination. I got really scared at that moment. I thought, how am I going to see a specialist if I don't have full medical coverage?
Aurelio felt he was facing a life or death decision.
At the time, because I value my health, I didn't think about the finances. So I made the appointment. I saw the heart specialist. And then I was faced with very high bills that I had to pay out of pocket.
When the pandemic hit, Aurelio had to take on 3 jobs as a waiter, construction worker, and gardener to try and cover his medical bills and keep a roof over his family's heads. Fortunately, a friend told him about the Community Health Alliance of Pasadena, known as ChapCare, a nonprofit federally qualified health center with clinics throughout the San Gabriel Valley.
We predominantly serve the most vulnerable within the community, so the undocumented, seniors, the homeless, and really just anyone that's experiencing financial hardships as well.
Aurelio is one of more than 12 million low-income Californians who relies on Medi-Cal. But the state-funded program had a lot of limitations and restrictions until the passage of the healthcare trailer bill, AB 133. The new law makes California the first state in the nation to expand full-scope Medi-Cal eligibility to low-income adults 50 years of age and older, regardless of immigration status, a major milestone in the state's progress towards universal health care. Senator María Elena Durazo helped push this legislation through.
The expansion would mean that they are eligible for a full scope of health care. And the reason that's so important is because that's where we cover preventative health care. It is far cheaper for us to provide preventative health care, things that we could catch early on, and then it's not so expensive. Emergency room only health care is far more expensive and does not deal with the underlying issues.
Now, approximately 235,000 Californians over age 50, like Aurelio, are newly eligible for Medi-Cal. Their coverage will include preventative services, long-term care, and in-home supportive services. It also expands behavioral health initiatives supporting California youth and people with severe behavioral health challenges, including those experiencing homelessness, and extends eligibility for postpartum mothers. Another major change is the phasing out of Medi-Cal's asset test as a qualification measure.
Right now, the system is you'd have to be impoverished, completely impoverished, in order to have Medi-Cal. And so what we're saying is we should not judge the ability to be able to get Medi-Cal based on whether or not they own a car or whether or not through their whole lives they've started to buy a home. That should not be used against them.
The changes in Medi-Cal coverage are critical for the people that clinics like ChapCare serve.
It's going to definitely impact them in a positive way. So a lot of our patients are enrolled in programs like My Help LA, or they pay for services on a sliding fee scale. So that means they pay out of pocket, right? So with this new healthcare law, they'll be able to access further financial assistance that will help them pay for their much needed medical treatments.
The new law has given Aurelio a new lease on life and provided his wife and 3 daughters with some relief. Does it give you hope to know that now you're going to be taken care of and that you're going to be healthy and you can really look to the future?
I'm really thrilled about the changes because now I can see a cardiologist that can really help me look into what's happening with my heart.
So you're looking forward to seeing your daughters go out into the world and do great things, I imagine.
I'm really happy that I'll be able to stick around to see my daughter's successes and see my grandchildren when they have some. So I feel more secure about my life.